because it makes you really very uncomfortable and feel not a bit well.
Patient feedback is phenomenal. Patients seem to really value it as a service.
Suddenly you can find that you're having trouble breathing, your chest tightens up and you can't get a breath in or you can't get a breath out. And it's very frightening.
It's a really easy service to use. It was easy to implement. We had a lot of support from the Met Office.
Hello there. Well, the weather's certainly going to stay unsettled and there will be a high level of circulating viruses. During the course of Monday, we'll see bitterly cold northeasterly winds, temperatures not much above freezing and plenty of sleet and snow showers. And that may well lead to your airways becoming narrower and there being a greater risk of picking up viral infections. Now, during the course of Tuesday, we'll see the cold weather continuing with very strong southeasterly winds, rain in the south, turning to snow as it moves northwards, putting at risk the 1.5 million sufferers of chronic obstructive pulmonary disease in the UK. That's your weather for now.
Hello?
Hello. This is an automatic telephone call on behalf of your GP practice for the person in your household diagnosed with COPD.
The Healthy Outlook COPD Forecast Alert Service, run by the Met Office, has been developed to ensure your patients receive treatment and medication when they most need it at high-risk periods through the winter. The system works by identifying risk, who, when and where, and by encouraging patients to adopt clinically valid measures to help keep themselves well and out of hospital. In areas where the system is already operating, there has been a fall of about 20% in COPD-related hospital admissions. Every year, chronic obstructive pulmonary disease accounts for 37,000 deaths and more than 1 million inpatient bed days. The cost to the NHS is about £800 million. The weather plays a big part in the health of people with COPD, but accurate alerts can help reduce these statistics. Patients are at most risk during the winter when cold weather develops. So, with advance warning of these weather events, patients can help themselves to keep fit and well and out of hospital. This is where the Met Office COPD Forecast Alert Service comes in.
All patients with COPD will benefit from the service. We've looked at the data and we found that during these winter peaks that we forecast, the bulk of admissions during these times is from the low and moderate risk group. High-risk patients generally admitted fairly consistently throughout the year and don't really fluctuate during the winter. So the peaks are made up of the low and moderate risk group, and generally high-risk patients are often quite well case managed anyway by their practices.
The feedback's been very positive. I've spoken to a number of patients who've enjoyed being involved with their problem, making a decision, having the medication at home, feeling quite sort of reassured that at weekends or in the evening there is something there for them.
It just gives them reassurance really that they're being managed, they're being looked after, they've got that contact with primary care, they know that somebody's going to call them. They also have a patient pack, which I think they found really useful. It's just a really good sort of reference guide, giving them information on what they need to do if the weather gets colder.
So, this is how it works. GP practices who subscribe to the service will receive an email which gives notice of an elevated risk based on the Met Office forecast. Patients are then contacted by an automated call at a convenient time specified by them. They receive 2 further calls if they are not answered. When the calls are complete, practices receive an email to alert them. A link takes them straight to the call results. The patients may have indicated that they do not have enough medication and/or their symptoms have worsened. The call will remind people with COPD what to do if they do not have enough medication or have worsening symptoms. Practices can make follow-up calls to patients if required.
Are you the person in your household diagnosed with COPD?
Yes.
Do you have enough medication for your COPD to last for the next 2 weeks?
No.
If you need a repeat prescription for the medication you require, please contact your practice.
When the call is complete, the GP surgery will receive an email with the call results for potential follow-up. Patients already using the service say it's given them peace of mind.
Well, at least you don't risk going out with the weather is really bad, you're forewarned, which, you can't be any better than being forewarned.
Excellent. Really was good. Self-medication means that you start taking the medicine before you would otherwise get hold of it.
Out of 53 patients that took part, only 2 were admitted to hospital over the winter, and we would have expected that to have been higher as in previous years.
For more information on the Healthy Outlook COPD Forecast Alert Service, just go to metoffice.gov.uk/health. Thanks for watching.